Welcome to HITea with Grace, where we spill the tea on HITea. I'm thrilled to be at 2024 today, speaking with the industry's greatest leaders about the industry's greatest problems and the solutions that are solving those problems. I'll also be learning about leadership strategies that keep these leaders at the top of their game. All right, tee up.
I'm very excited. This year, 2024, is the year of nurses at Vive, and I am a nurse. I'm Lisbeth Votruba. I'm the Chief Clinical Officer for AvaSure.
Thank you so much for joining me today. So tell me a little bit about what you feel to be the industry's greatest challenge.
So yesterday someone said, hey, we just found out this morning that there's a workforce issue in healthcare, and that got one of the biggest laughs at Vive this year. So the biggest challenge, hands down, nobody's going to argue with it, is about workforce. I'm particularly concerned with the nursing workforce as a third generation nurse, and it's not just a simple shortage, it's a trifecta of losing the experience of older nurses and newer nurses not having the full support as they come in, and more complex patients. So it is creating a perfect storm that I still want to be hopeful about, though. I am very excited. Places like Vive is where we're talking about how can we come out of this crisis and really be better than ever.
Interesting. I'd also love to learn more about what innovations are solving those challenges.
We are being very innovative to solve this problem, and it's not, and I like to talk about virtual care, and it's no longer if we're going to implement virtual care, but it's how are we going to implement virtual care, and how are we going to try to pay for that. And so the buzz and what I learned from healthcare partners is it's about an adoption model that starts with something foundational like virtual sitting that can really fund, has a great ROI and improves quality, can therefore fund the next level of virtual nursing, which often starts with a task-based virtual nursing where they're just focused on some documentation tasks, moving up to a co-caring model where a virtual staff is just part of the care team, and then getting to the place where the room of the future is just seamlessly integrated. And my vision would be like the care provider, whether it's a nurse or a physician, and whether it's a hospital room or a clinic, is almost unaware of it. But it's kind of seamlessly going around in the background and integrating using generative computer vision AI, as well as artificial intelligence scribes. And ultimately, this sounds counterintuitive, but that would bring joy back to nursing and bring humanness back to nursing. And I keep defaulting to nursing, but I really mean patient care, whoever is providing it.
Now, moving on to the personal side, what advice do you wish you could give your younger self?
I think the advice would be to not be afraid to be ambitious and manifest where I want to go. And one of the great things about a conference like this one is the being together and having a little downtime. So last night at dinner, I was with Sylvain Trepigny, and he's the chief nurse executive of all of Providence Health System. And he talked about when he was a nursing student, he knew he wanted to be a CNO. And he built his career on that. And then on the other side of me was a nurse earlier in her leadership career. And she had told me earlier in the day, I want to be a CNIO. And so she's manifesting that. And so it was really great to say, hey, Brittany, manifesting something like that actually works, meet still. And so I think it's don't be afraid to be ambitious. Some of the best leaders are the reluctant leaders, and some of the best leaders are those that are excited about leading, even from a young age.
Thank you so much for joining us today. We loved learning from you. And thanks to you for joining us too. Check out the HITea with Grace podcast website and YouTube page for more great guests like the one today. Cheers.